Okay, there we go, I know.
All right. We should be.
All right,
all set.
everybody's just calm down.
Hold on, I have a lot more. Whenever you're ready to start.
Okay. All right, let's start the meeting. We have the employee council with us this morning to talk about the 2027 budget. Welcome.
Well, thank you. So I present you guys with a couple sheets of paper here. I've got 4 requests, or the employee council has 4 requests. The first one would be an increase on-call pay. We've had some discussion with some of the employees, on campus about liking to see a higher, pay. Each one I gave you guys was its own packet.
Right.
So if you guys, Julie, yours is right there on top of your binder. Yep.
Thank you.
Me.
Did you got up? I was trying to hand it to you, sorry.
Thank you very much,
Take
sorry.
So it talks about, currently we're getting $2.50 an hour for on-call pay. I know different departments throughout the county has on-call pay. But it's been, to my understanding, it's set across the board as all county employees. So they're asking for a 50-cent increase on that, which would bring it up to $3. I know that does affect some people's wanting to work in certain departments, knowing that they have to be on call. So that might better reflect in ability for new hires to wanting to do that. Do you guys have any
So
questions?
just to be
Yes.
clear, they're paid $2.50 an hour just to be on call. If they're called in, they would.
Then it reflects on their normal time. Yep,
Right, thank you.
certainly. Any other questions on that one at the moment? All right, cost of living. Julie had sent me an email that's reflected on the second page there. Which my understanding is the same verbiage as a union here is doing. Reflecting on that November, from that, Boston, Cambridge, Newton, Mass, New Hampshire study, from the CPI. The only opposition I heard to that, when talking about it was that it's 10 years, looking at 10 years of doing it. Whereas everybody's a little nervous about change, you know? So, my thought was on that was going to 4-year, agreeing to 4 years of following that, and then 3 years, so we're ahead of schedule, so we're not interrupting it at all. We just have another conversation about it, as whether we look at moving forward.
We're not talking about doing it for 10 years, we're talking about a 10-year rollback period. So the look back would be 10 years
Okay,
Taking the average of
that.
Oh, okay.
It would not be.
I thought it was
like
for
this
10
was
years.
oh,
No. It would just,
okay,
Well, that changes things.
yeah, that does. Okay,
using the 10 years averages it out more consistently. Example, COVID, I think the cost of living rate was like 8% or 9%. In years, back in the early 2011s, it was a negative something, so using the longer time period just averages it out. We've been told that it pretty consistently averages around 3%.
Then that would just be ongoing.
Until we negotiated a change.
Okay.
okay. All right, nope, I like that. That simplifies that one a little more for us. So we do agree that we like that theory, and we understand the benefit to you guys about doing it in November, so that the department heads can have that information ahead of time, and helping with your guys' budget. So we do like that. The boomerang proposal. So, there's a study that starts on your 3rd page in your binder, that's 2 pages. I'm not expecting you guys to read it right now, but for a little information about it. And it talks about the retention, not the retention, but the return of employees to companies. I know that like the county has a LNA program, which is great for young people starting right out of high school. And then they go off and go do something else where they might return. So in not talking pay, we're talking what what else could be offered for a returning employee? And if we looked at just the earn time scale, where it's that 1 to 5 years and then it jumps to 5 to 10 and so on. Looking at being able to hold some of their credits for that. So when an employee returns, maybe they did 5 years or 10 years, and then they left because they moved out of state and they came back. Now they want to come back here. Okay. For whatever the reason they left, now they're coming back outside of the pay, or any other benefits that we have for them, because pay is determined by the scale and the department heads, to my understanding. This would be a perk that could be offered as well, for returning employees, giving them more earn time, because they're coming back to us. One, they know a little bit about us. Like for instance, right now we just hired back a chef. The county didn't have to pay the same amount of training as someone that had never worked there before. Okay. Because they didn't have to go through as extensive of training because they were a previous employee. So there's perks to both sides of it for hiring back a former employee.
I think your example on the nursing is interesting. So if an LNA who leaves to do a nursing degree could come back
Yeah.
as our retain, yeah.
So, I mean, I know the LMA program personally. My sister went through it right out of high school, and she worked here right through college. And, you know, had she continued her medical path, you know, she could have come back down the road, whether that 5 years or 10 years or whatever that would look like, and still had some type of benefit to coming back, or a reason why we were drawn back in. I think that might help for retention or future hire of employees coming back to the county. So,
Are you looking that it would be open-ended? So if somebody left and came in 20 years, or are you looking like it would need to be within a time frame?
so I wrote it open-ended, okay, because as we all know, negotiations are negotiations.
We start somewhere.
We start somewhere. So I left it as an open-ended thing. And then with you guys doing your own conversation on it and conversation with possibly HR, to see how often, what time frame they might have for data on returning employees. But it's wrote it as open-ended. And then, number 4 is annual, baseline blood draws. So that was brought up to us, from an employee or employees that, other departments do this. And I think it would benefit all employees across the complex, whether it be that they were exposed to something here or outside of here, a blood draw more frequently than when you feel like something's going on in your body. Usually something's already happened. Okay. So if you're going to the doctors because something's going on and you've been exposed to a bloodborne pathogen, this could potentially pre-screen them. Okay. That's what it is. It's a baseline. Not asking for recognition of that they got it here or anywhere else. It's that this would give them a baseline, versus going to a doctor and requesting it every year and paying copay and all this other stuff. This is a practice that happens at other places.
So I would be interested to know what blood draws are talking about, because the ones you just mentioned are not ones that are routinely done.
Correct.
And as a nurse practitioner, no, well, let me finish.
Okay, sorry.
But as a nurse practitioner, when I would have people who had routine blood work, it would not be for bloodborne pathogens. It would be some of their wellness. So what you're talking about is wellness labs, which are very different than looking for bloodborne pathogens. You know, hepatitis B, HIV, whatnot. Costs are very different, and
Okay.
how things are billed through a medical office. So this is, I would be very interested with this proposal if you come back with what you've learned and what's actually done in other places, because I was a nurse practitioner for a very long time.
Yep.
And I never had anyone come in unless they were tested through an occupational health or something for an exposure.
Correct.
And I'm not really sure that this would help with what you're looking for. So if you could in some way get me that, what other people are doing, I would be interested
Okay.
because I'm not clear on this.
Okay. It is recommend or referenced from bloodborne pathogens, not your routine lab that you would get. And I mean, we all have little nicks on our hands, but we all work in fields on this department or on this land here on the county that exposes us, whether it be the nursing home, the sheriff's department, or over at the DOC, to potential of these things. I know that if we have an exposure, we have to go get testing done through.
I would just be interested to see what was done because
Sure.
like I said, in my many years, I've not seen this as or no one's given it to me. That's the other thing is
Fair
that,
enough.
people don't necessarily bring those in. So I'd just be interested to see what it was.
Yep.
And then the depth and breadth of it.
Sure.
Yeah, that would be really interesting, I think, to see
Yeah.
how it's being done in other places and the reasons.
And not that it's necessarily a bad idea. I just am having a hard time putting my mind around it.
Sure.
Questions?
I don't have any. Thank you. I asked mine. And you have questions on the COLA that we, that it's the 10-year average and not do it, instituting it for that way.
No, I think it was just, it does come out with a different number than doing in November and November of that 1 year. But I still think I've looked over and past years, and I'm not sure if I'm all the way back 10 years, but knowing that it was say in here, I believe it was a 3.03 is what they, looking at. I think that's a great cost of living and allowance. So.
Okay, well, Julie?
I do not have any questions. We can review all of this stuff and we can get back to you a little bit if you can follow up with.
Yep, I'll be.
Thank you.
Well,
Thank you.
Like, thank you.
Thank you for taking time to come in.
Yes.
wonderful day.
It's a beautiful day in the neighborhood out there.
Until
Rogers.
right now.
Until this is right now, okay.
Enjoy it.
Did anybody see the lunar eclipse this morning?
No.
I couldn't see
I
it.
got up and I didn't see it at all.
I couldn't find this up.
Yeah, I couldn't
But it was
either.
at 5 so wasn't going looking for it.
And it was
I went outside, I couldn't tell you find it.
from our house, where the trees are to the west, we're like, oh, no,
Yeah.
it's setting.
But the moon was gorgeous last night.
It was.
It sure
It was
was.
beautiful.
Yeah, sure
Yep.
was.
Like, well, it was July, it was, 50 out, I'm like, oh, look.
Mhm.
Same thing, I'm surrounded by trees, so.
Erin wasn't here, she was feeling.
There she comes. Morning.
I'll get you a copy of the employee council stuff.
They gave one.
Oh.
I was listening.
You were listening, I just didn't know they gave you a copy.
Good morning.
Okay. So, um, since I was here at the beginning of February, we hired 8 new employees in the nursing home. 7 full-time. Those are for our LNA course. We did, we did fill that class. Max we can have in the class is 8 students, and we had 1, so we hired 7 and we had 1, who is a full-time cook in our dietary department right now, so
Oh.
she's gonna be taking the class and transfer.
Very nice.
And then we hired 1 per diem LNA.
Has the class started?
The class started on Saturday. Yes, the class is running Saturday, the 28th. Anticipated final testing is May 23rd. we had 2 separations in the nursing home.
I think that was your phone.
Um, one full-time LNA and 1 part-time dietary aide. And we had, 1 separation in the dispatch center, 1 full-time dispatcher. We had 2 resign for personal reasons and we did have 1 termination. Status changes, we had 1 full-time LPN who transferred to per diem. And we had a full-time cook, who again transferred to the LNA student position. We have 36 active FMLAs right now. 9 in our nursing department. All but 1 are intermittent. We have 14 others in the nursing home. All but 2 are intermittent. Or in the county attorney's office, 2 in HR, 2 in corrections, 2 in alternative sentencing, and then 1 in maintenance extension and the commissioner's office. We don't actually have anybody scheduled to orient tomorrow, so that's not a great thing, but I don't have anybody scheduled to come in. We currently have 13.95 LNA vacancies, and we have 6.45 nursing vacancies in the nursing home. We are hiring for M&As. We have a deputy sheriff position available, a dispatcher position, the full-time cook position in the nursing home, and a part-time cook position. We also have the 2 travelers that you approved for the Department of Corrections, the night shift. We have 1 who started on Monday and we have 1 starting tomorrow, so those night shifts will be covered. Other than that, I have a meeting scheduled Thursday to review healthcare quotes or declines. I know already that some have declined to quote us. And we are looking at a self-insured option that would entail and whether it would save us any money and what it involves long-term. And there's a lot to the self-insured piece of things. So a lot of things to look at and think about there. And would it even save us any money? So,
Right.
I
think you have a lot of startup costs to that too.
You don't really, because you take your premiums that you're normally paying to Health Trust. So you put that premium money in your claims.
Yeah.
So that's how you.
Have a reserve.
You buy a
Stopgap.
Stopgap, okay.
And the other issue with that is if, there happens to be a couple of major illnesses, they're often in the millions of, a cancer or a terrible accident. And you don't know when those will happen, and we're big, but we're not that big, so it would be hard, some would have to look at those
Right.
potential costs for something like that. And if the year that everyone's healthy, then you save the money, it just is, those are. the
Yeah,
variables.
that's where your stopgap insurance
Yeah.
comes in, but obviously if you're having big claims,
Yeah.
your premiums for stopgap are gonna go up and up now, so.
The other thing is, I think that we have a lot of, extra benefits with Health Trust that we would have to figure out. I know the Personify Health, a lot of employees use, they earn money each quarter. Now we have the Hinge Health, we have the Included Health, we have a lot of extra benefits that would not necessarily, we'd have to figure out how to structure those if we were self-insured. So there's a lot to it. I told Karen, we were listening to a presentation a couple weeks ago, and I said, they might as well be speaking French because
Yeah.
so luckily Karen understands it much better than I do.
I mean, there's a lot to it, but I mean, at the end of the day, Health Trust is making a lot of money.
Got that
Yeah,
right.
none of my points were that we shouldn't look at it, it's just, there's so many pieces to it.
I think there's a tail too to it that you have to have some money in the bank for. The tail is what you pay. So that ends, if you decide to end it, then you've got all of those claims that you have to process that will go
Right.
far into the next year.
Yep.
So it's almost like that's the cost to it.
Yep.
And then what percentage do you pay the company carrier that's managing it, you know?
Yeah, and the quote is all broken down into that. 'Cause
Yeah.
yes, you have to have a third party administrator. I know that the two counties that are self-insured are very, very happy being self-insured. We just had a third county go self-insured. So, they're having good experiences with it. I haven't talked recently to, I think it's Carroll County that just went self-insured a few months ago. So I'm anxious to kind of follow up with them and see how their experience has been so far. But both Cheshire and Rockingham are self-insured, and those are huge counties Rockingham is a huge county, and they've been self-insured for a really long time.
I think the
So-
state went to self-insured, but then I was listening to one of the hearings and I thought I heard the Commissioner of Administrative Services say they were going to move out of being self-insured. So I don't know, it may be worth checking in with them,
Yeah.
who manages that.
Um,
It's no fun either way.
Yeah.
And
it's expensive.
It costs a lot of money.
either
Yes.
way.
Yes, sure. Exactly. And at the end of the day, we may just say we have to absorb the increase with health trust, and that is what it is. And go.
What is the increase? Remind me.
So it's overall, I think, a 23% increase.
26 for our lower cost plan, which is where the majority of our employees are.
Yeah.
So it's based on our current numbers, it's a little over $1 million increase for next year's budget.
And health trust hasn't, quite honestly, in my opinion, been flexible or helpful in any way, saying, here's how we can alleviate that cost. They're almost like very nonchalant about it, like, "Yeah, it's 23%, it is what it is. Health insurance costs a lot of money," and that is true, and I understand that. However, work with us a little bit here on some other options. And
Well, and they wouldn't even we just had our highest cost claimant passed away, and those expenses are gone now, and they won't even relook, our prices were quoted before that happened, and they won't even relook to see it.
Oh, gosh.
I mean, they're very rigidly structured and
Sounds like it.
rightfully so. That's what a public risk pool is. So, they offer a lot less flexibility in some areas, like looking at that and maybe possibly re-rating. So we'll see. Hopefully we'll have a lot more information after Thursday. I am looking for permission to close the Human Resources Office, May 21st, to attend an all-day employment law training, that Sheehan Finney puts on. I think it's helpful for not just one of us to go, but all of us to go and kind of do a little team building day, and I'll get the same information at the same time. So, if that's,
Sounds good to me.
do they have to?
The motion, do we need
I
a,
think we need a motion.
probably?
Yeah.
Yeah, so I make a motion. Do you want me to make a motion?
Please.
Okay. I'll make a motion for the Human Resources Office to be closed on May 21st for all staff to attend an employment law training.
All in favor?
Aye.
Thank you.
Motion passes.
And then the only other thing I wanted to mention is we're in the process of putting the benefits fair together. Right now we have it scheduled for June 4th. That takes place in the activity room in the nursing home. We usually do it in May. We did push it out a little further this year, just in case we have health insurance changes that we have to prepare for. And get rolled out so that anybody can ask final questions at the benefits fair.
You'd be doing the benefits the same way you did it last year with.
We are planning on doing that. I think we got a lot of good feedback. on
That was great.
That was the telephone calls to the employees that they went through all the benefits, so employees didn't forget that there were things available to them.
I thought that was extremely helpful.
Yeah, it also reminds people like who they have on the plan and.
Right.
Yeah.
That type of thing, so if people got divorced 2 years ago and forgot to tell us, or, have children that are close to aging out, they can be prepared for that.
I have one question. Is there any, looking at such a big increase in health trust, I know in the Plymouth area, because I was on school board, a number of places that had, got insurance on their own combined, like in the Plymouth area, it's Plymouth Town and a number of the schools, and I think a couple of towns are all in one policy. It kind of evened out the rate changes for the different smaller entities.
Mhm.
Would something like that, is there a way a county could do something like that? Just because it just increased the pool, to that, so it helped even the costs a little bit.
Yeah. That's funny you mentioned that. I think the town of Haverhill approached us about that several years ago. I don't really remember why we didn't head that direction, but yeah, I mean, it's definitely something. um, I can kind of make that part of the conversation on Thursday with our broker and see what their thoughts are on that type of thing.
And it was a number of years ago that it happened, but it just really increased the size of the pool, which was helpful, especially for the smaller entities.
Sure, I can ask that question and get. And it's the town of Plymouth, you say?
Yeah, the town of yeah, it's the town of Plymouth. I think most of the schools in SAU 48, because each of the elementary schools is their own entity.
Mhm.
And I think there's also a couple of other towns, but I don't want to say which ones, 'cause I'm not sure.
Right, right.
So,
Almost said.
Great. Thank you.
Thank you.
Good morning. Can join us.
good morning.
Morning. Oh, this is little. To the eye.
What's that? This is little to
To
the
the eye, yeah.
So good morning. As of today, our census is 119. We do have an admission coming later today, and then the potential, we're just trying to figure out transportation, but I think there's a potential for 2 more tomorrow. So we're kind of getting back up into that range where we were wanting to be. It's been just continued to be a kind of an interesting month, February for us, just with activity. And then with referrals that we were receiving, just we kind of hit a patch where there's the acuity of the referrals have been such that, perhaps certain conditions requiring private rooms, and our inability to meet that requirement, or behaviorally not a good fit, complex wound management, that would have been beyond our capabilities given our current acuity level in the building. But we do have, I think a half dozen anyway referrals that we're working at right now that seem to be more kind of in that wheelhouse for us, and something that we'll be able to work on. So I'm feeling good about getting that census number back up to where we were at prior. So as you'll see, our Medicare census is doing, trending right in the right direction there. New Hampshire Medicaid, still dealing with the pendings. Once those go through, we should be right where we're at, hopefully, or anticipated to be with the budget. Still not hearing any kind of positive traction on that, the vendor that the state of New Hampshire has entered into an agreement with, to help on the Medicaid backlog at the state level. Interestingly enough, it appears as though any there were still, as of 2 weeks ago, there were still 3 positions that needed to be hired by Public Consulting Group. That's the vendor that was awarded the contract. So they do have 4 people that are, kind of currently out in the field, working with long-term care facilities throughout the state on the backlogs. Interestingly, I learned that these individuals are not able to make final determinations on Medicaid
Yeah.
approval. So they move it forward to sit on a supervisor's desk within DHHS. And so that backlog is not necessarily going to resolve itself any faster, I don't think. So some of the technicalities or technical details of the contract and the process that you're not made aware of until it actually gets up and running. So I don't know if this is a permanent thing through the life of the contract, and whether it's always going to be ultimately a supervisor within DHHS that makes that final approval or not, or if this is still leaving the training wheels on for right now until these guys get more up to speed and comfortable with how the Medicaid approval process works. And so as it stands at the moment, there isn't going to be any significant dents being made into that 113-day backlog of cases that they're working on right now. So Vermont Medicaid still doing well there.
Maybe they could give me some Medicaid some pointers.
Simplification is the pointer, Julie. It's really is what it comes down to. They're a lot more user friendly when it comes to applying for and decisioning and their asset rules and everything. Yeah, a lot more friendly for applicants. VA, we had a couple residents pass away that had been on the under VA contract, and so that's the decrease that you see there. And private pay is still holding to be pretty good right now for that. So during the course of the month, we had 6 admissions and we had 4 residents pass away and 5 discharges. So, and we do have another discharge planned for this coming Thursday as well. So we do have a kind of yo-yo effect going right now. We have a resident that's going to be discharging to Merrimack County Nursing Home to be closer to family on Thursday. So nice comment from the family. I believe they said that if they could take Grafton County Nursing Home and put it closer to them,
Oh, that's
they
nice.
would do that. So they were extremely complimentary of the staff and just the building overall. So
Nice.
yeah, so that was nice feedback.
Questions?
Yeah, I was speaking to a constituent last week and about many county issues, and we were discussing the nursing home, and they had questions, which I answered. They asked if, and I'm hoping I'm correct, if we ever put a Vermont Medicaid person ahead of a New Hampshire person because they reimbursed better. And I said I did not think there was a waiting list, and we took the admissions as the referrals came in, and that we were, again, didn't have a waiting list. So I did not think that happened.
That's correct. Yeah. And if everything was being equal, we would take the New Hampshire Medicaid recipient from Grafton County over. Yeah.
And I did say that, but I did say I would check.
I'm all set. Thank you.
So just the other section here, this coming, or not this coming, but next Thursday, the State County Finance Committee meeting or group is going to be having a meeting specifically to discuss rate methodology. Kind of working as a committee to talk about how rates are being calculated right now. This is really stemming from the pretty significant cut that a lot of facilities received, and thankfully the money that was identified by DHHS to help get transferred in and bolster the rates, or lessen the impact of the rate cuts. But that will be a specific discussion to be had. It's a dedicated meeting. There will be no other business discussed other than that at this March 11th meeting. But it also kind of ties into a Senate Bill, Senate Bill 663. That's calling for the establishment of a Medicaid methodology work group. And so I just wanted to bring that to your attention as well, in case that you hadn't been aware of this, this bill. It was a late file bill. Really, the idea, I think, is such that the New Hampshire Healthcare Association has pushed this bill because a lot of their membership was very upset in regards to the rate cut that was projected to be received in January. There's also been a feeling as though amongst the New Hampshire Healthcare Association membership that the methodology that the Department of Health and Human Services is using to calculate rates is faulty. And so they're calling for legislation to create this work group to identify or to find out exactly how the department is calculating their rates. And I see if there's ways to improve that process, and perhaps, without getting into the weeds too much, the factors that they include into the rate calculation, see if they're using the right measurements to assess acuity across the state. And are there other options that they could be using in that acuity assessment that might create more of a level playing field versus the kind of roller coaster that we run into from time to time. The other kind of piece of this, so from the county's perspective, I think that it's something that we'll keep an eye on. We would be supportive of, if there is indeed a faulty system in place in regards to how the rates are being calculated, we would certainly want to be, involved in that discussion and aware of it. The bigger piece, though, is that if there is an issue identified, there's the potential that could come back and get us on the side of the payer side the payer hat that we wear. Because if there does need to be more money into the system, where is that money
Where's it
going to come
coming
from?
from?
So, so the other piece to this is specifically in regards to rate calculations for ownership changes in the state. It continues to see a large number of facility transfers, sales taking place throughout the state. I think the last time that I heard, there were 6 facilities that were in the process of changing hands. So that continues to be a concern, I think, from our perspective. And the owners of these, or soon to be owners of these facilities, are requesting, and very loudly at times, requesting that rate consideration be given because they're taking over facilities with lower Medicaid per diem rates, and they want to have a better system in place to, potentially come in with the intent of infusing money into the building to improve the physical plant of it, for instance, which when you calculate a Medicaid rate, capital costs do get included in that. And so they're trying to potentially artificially increase or requesting with the infusion of this money to artificially increase what they would think their Medicaid rate should be. So
Wow.
that creates a little bit of payer disparity as well, with not a lot of funds in the line at the state level to be able to compensate for or make adjustments for any rate changes mid-cycle like this. So.
It'd be nice if when the state comes up with their rate, and then they take that 25% off for, I can't remember what that's called.
Adjustment factor.
Adjustment factor. I think it should be written into that language, should be written in there where that 25% is gonna come from to make up the difference. So it's clear that the counties then somebody has to come up with that 25%, because the real cost is that number.
Yeah, minus the, yeah,
Yeah,
yeah.
and I just think it should be transparent.
Yeah.
Where that,
Rather than just an artificial.
Yes.
28%.
We're just taking 20,
Yeah.
and we're just not paying you for that.
Yeah.
It should say in there that 25% is taken off and that is expected to be paid by the county taxpayers or
Yeah.
whatever. it is.
Yeah, no, to have it
No, I think it should
specifically
be-
called out for, sure, yeah.
It should be called out.
Yeah. So we'll be keeping an eye on that and see where that plays out here in the coming weeks through the session. But yeah, it should be an interesting meeting on March 11th, so.
No, thank you for you're involved in that, right?
Yes, yeah,
Thank you.
we'll be there, so gonna be meeting with Kate Horgan and David Roth on Friday to kind of just strategize our feelings of what we want to be talking about and just, be on all on the same page on that, so, yeah.
I'm all set. Thank you.
Thank you.
Thank you.
Wow,
I told you streamlined today.
yeah.
Look at that.
So commissioners' issues, we'll start with our minutes of 2:25.
I had no changes.
I did not either.
Well,
Get that?
across the board,
Hey, hey.
had it easy. And I wasn't sure which one of you were actually taking that piece on, so.
I got your email that you sent to Sam and I got the one
Oh,
you sent to
okay.
me. So, cause I checked Sam's email this morning, cause I hadn't heard from either of you guys, so. You emailed Sam.
I
And
did.
then Julie, these are all set.
No, for God's sake.
And I didn't because I thought she is getting so many extra emails. But I told her this meeting.
Okay.
I'll make a motion to accept the minutes as written.
Second.
And all in favor?
Aye.
Motion passes. So next we have check registers. Not too many, but it's good.
A few of them, yeah. Doesn't seem to be a week that goes by that the folders get smaller.
As usual. Oh, no. Did you say that? No,
Earlier,
They are
right,
now.
they are now. You should have been able to log in now.
Okay, yeah, I think I just wanted to make sure I was really up to date on that.
This is the application from families. Add to
Oh.
your social service.
Oh, yeah,
Okay.
good. Thank you.
She did also contact me and said she also saw that we did opioid abatement funding. She did check yes on that, so I was gonna let her know that we will not likely do both for their agency, but and that you all would probably decide if we had opioid abatement funds, if they came out of that versus social services, so. Unless you'd like me to respond differently.
This one seems to be well put together.
And just a reminder that we will discuss those on April 2nd, so that's when we'll be trying to have your recommendations put together for senior services, so. We got from Mr. Buffetti, Attorney Buffetti before that. was
Yeah.
Direction.
So, was that all right, what I wrote? down?
Yeah,
Okay.
perfect. Later last week, I mean, I sent you, a written request from Register Monahan, who is seeking the appointment of Kimberly Carpenter to the Deputy Register of Deeds, and per RSA 478:2, the commissioners have to approve that. it isn't, the deputy register position is open in the deeds office, so I would
There's no reason
just
to not do this. Thank you. Done this before.
we would just need a motion to appoint Kimberly Carpenter to the deputy register of deeds. And it's effective March 8th, which is the start of our next pay period.
I had no questions about it.
I don't have any questions.
Okay, does anyone want to make that motion?
I will make the motion to appoint Kimberly Carpenter, to the, assistant
Deputy.
deputy, register of, oh, there it is, deputy register of deeds.
Second.
And any other questions on that?
No.
All in favor?
Aye.
Motion passes. We have CDBG closeout documents.
We do. We just have one document. Actually, I think all three of you have to sign it.
NHARDC.
New Hampshire Alliance of Regional Development Corporations, and this is an old grant, it's 2022. We're just processing the paperwork, to get things closed out. Both the 22 and the 23 are in the process of being closed out because they're completed, so. This is just the formal paperwork that needs signature, and if all three of you, I'll do the rest. You
Just
just
do the type.
if you
name
just
and
sign
title.
it, yeah.
Okay. Print.
I'll just take care of it after
Okay.
we're done. The next item of business that I have is the paperwork for the lease agreement with the state for the court system. First piece of paper is a certificate for municipalities, which Commissioner Hedberg needs to sign. It states that she's the duly elected clerk. We had a properly noticed meeting today, except that's not March 4th, it's March 3rd. I don't know why I keep thinking today's the 4th, but regardless, I have to fix that for you. It just says that, Commissioner McLeod is authorized to sign all the paperwork, to execute and effectuate the lease agreement. And then this is the lease agreement, and sorry, but that's your initials on every page, and the page that's tagged needs your signature.
And the 3/3 date is what you
Yes,
need on this.
please. Need to find their certificate for municipalities and update the date to 3/3. I did that. I sent the employee council the notice, and Andre called me and he's like, "You said Tuesday 3/4." I'm like, "It's not the 4th on Tuesday." Nope, as it turns out, it is.
I did that with a day last week.
Not.
And I had unfortunately, I had put things in my calendar
Oh.
for the, and it worked out okay, but I like, oh, it is today.
I think the whole March thing is difficult because the month, February is so short.
Mhm.
It just doesn't feel right. Like they steal 2 days from us. And I think the time changes too.
This weekend.
On Saturday to Sunday,
Yeah.
but it will be light till 7 o'clock.
Isn't that nice?
Thank goodness.
That's
Yeah.
nice.
I found that the other day when I was looking for it.
Well, I will be here doing the invoices, so.
No, I found it.
Okay.
I just, I found the one I was looking for last week. And then I retyped it. It's all good.
Oh, and so this, I didn't realize there were back pages to all of these.
Oh, yeah, it's too bad. Sorry.
It's a lot of signing. The state
Yeah.
loves their paperwork.
Okay. I thought I was done.
No. Bounced you this up for the meeting and.
Okay. Yeah, I think there's a couple of problems. I can't, well, I guess I don't have to reset my password, but it just started happening where I can't. It says, it just keeps coming up saying, hold on a second while we sign you out, and I can't, and every time yeah. And that's happened before. Does that happen with
Yeah.
anybody else? You
Yes.
have to sign out first?
Yes.
So
all
mine
the
has,
time.
mine has simply won't move off the sign out phase.
I also find that as Microsoft keeps updating, they change where we actually need to sign in, and then it doesn't, it has a different. This is now the address to sign
Oh
in.
my gosh.
Thank you, ma'am. Next item on the agenda is the list of appropriation transfers, which was sent to me yesterday afternoon. They're not a lot, of them at this point in time. The biggest one on here is the veteran, prescription. RX. They did just sign a new contract with the veterans, RX stuff for March 1st that, Dawn has told me will help. You'll see it's $5,740 over expended currently. She expends, and that they've spent 80 to date. They only expect to spend, I think, 43 the balance of the year with their new contract. So I'm going to transfer 50,000 into that line item to get that through the rest of the fiscal year. But other than that, they're all fairly, you'll see a lot of longevity, wages, low health insurance. Those are just sort of transfers we do. Like someone will pick up, when they get hired, they'll take the wages in lieu because they already have health insurance versus health insurance. So there's typically money left in the health insurance lines to cover those.
Okay.
So a lot of this is just pretty much clean up from those types of items. If anybody has any other questions, I'm happy to answer them, but if not, I just need a motion to approve the total amount of the appropriation transfers.
So the total being $83,254.
That is
Okay.
You want-
Yeah, anytime.
Okay, I'll make a motion to approve the appropriation transfers that total $83,254.
Second. Favor?
Aye.
So after our conversation last Tuesday, I did follow up with Senator Shaheen's office. Actually was never able to speak with Chris Scott, but I did speak with, or I did have correspondence with Nick Brown and Elizabeth McKenna, both who feel that it would potentially be a good project, but that probably it's not far enough along this year to be able to get approval for it. Since the project has not received local approval yet, and we can't give them the total amount of what the project will cost.
Right.
That creates problems with the grant application. So we discussed it, and I think, if we're able to move forward, and get an approval for bonding of an up to certain amount, then we can certainly go in on the backside and try to find alternative means for funding and not need to bond the amount that we get approval for. And that would this would definitely be an avenue, although Senator Sheen obviously will not be a senator next year.
Yeah.
They did assure me that there will be, House members and other members that will be doing these similar types of things, and that this project would be a good match to do it once we have
Nice.
some more information. So we'll not be doing a CDS application for this round this year, but we'll keep it on the radar for next year.
Did they give you any idea of the amount that we could, was with a particular project that would be?
No, we didn't discuss those details, just because the whole project itself isn't really where they feel it's at to be able to get approval through the process. We have time now, and like we'll be able to know, and like maybe if the project looks like it's gonna move forward and later this year, we can start looking at what we might specifically request funding for, like if there's specific equipment in the sheriff's department or the dispatch center that we need to buy, we could look at doing it for that. Or if there was a certain component of the building that we wanted to apply for, we'd be able to break that out and look at that at that point in time.
Nice.
Good try.
Yeah. Yeah.
And it's a good idea for the future.
Right. So it does look like good, yeah.
Yeah, I think we absolutely can. I just think this year's a little bit, they feel a
Premature.
little bit premature.
Great. Thank you so much for following up on that.
You're very welcome. The only other thing that after meeting with the employee council this morning, I wanted to follow up on is with the language that we have for the cost of living adjustments. The sheriff's department, because it's part of their contract, is including, when you get their department budget, it will include their cost of living adjustments in their requests.
Yeah.
Do you want the rest of the departments to do that as well? So it's all inclusive when you receive the first budget.
That makes sense.
Seems
I
like a
think
good
that
idea.
makes sense.
I agree. I
Yeah.
just wanted to make
Yeah,
sure that,
yeah.
and I need to reach out because people's
Then we're
budgets are
dealing with
due.
more realistic.
Exactly,
Yep.
right from the start.
Right.
So.
Yeah.
All right, perfect. That's what I needed to know. So I'll get that out to them today. So they can, I'll make sure that happens, especially the budgets are due next week.
I thought the employee council, since you brought it up, was very reasonable than what they were asking.
Yeah, absolutely. I think, the whole thing that didn't get brought up, that I think eventually, and when I say eventually, I mean relatively soon, is health insurance. I mean, we're gonna have to have some
Right.
conversations about
Right.
health insurance. And whether we're gonna change, whether we're gonna, what that looks like as far as the cost sharing and 25.9% increase is
Huge.
pretty sizable increase, so.
Gosh, sure is.
So that just,
Yeah.
we'll have to have further discussions with them regarding that as well, but. That is all I have for you today.
Right. Nice.
Nope, they didn't do commissioner issues, so you can go ahead.
No commissioner issues for me.
I just wanted to follow up on something that was said on public comment last week. And I did address it directly with a person who made the comments, but there was a comment that if we spend money on EMS services, it shouldn't be for one area of the county. So I reached out to the person to just confirm, and they did know that the EMS report that we got was for the whole county. And that we did put in application for information with the Rural Health Transformation Grant, but that if we're, when we get more information, we would need to submit another grant, but also that we would be looking to not just fund one department or one area, but it would likely be one area at a time. And when I had mentioned the area in my district, because that could be a potentially shovel-ready
Mhm.
project.
Mhm.
Yeah.
But that we would be looking at the county in general. And then I just, again, emphasize that we have not spent any money except for the report
Right.
on EMS services in the county, because I felt that there might have been some confusion that we had already given money places. So I just figured, if I was confused about the comments, other people might be also, and so I wanted to follow up on that.
Great, thank you. Thank you. Yeah, we also have the opportunity to change how we approach the whole project.
Absolutely, and we'll know more when we, and I did,
Yeah.
you know, when we find out how they actually may fund things, we may look at things entirely differently. And as we see what happens going along in town meeting, if there's other issues that come up in other areas.
Mhm.
And by the way, I did, for another reason, I did look at the agenda. And those organizations and the rural health transformation funding is on the agenda, and all of that information is there. So it is not, so that we know what these organizations are that they're talking about.
The executive council.
Council, yeah,
Right, so they will
Tomorrow.
discuss
I
that
think it's
tomorrow.
tomorrow. Yeah, so it's all there out in public.
Great.
And the amount of money, I can't remember the amount of money, if they're putting everything out there at this point, or if it's a part of. But anyways, it's something to look up in.
We'll have to look at that.
Yeah.
Counselor, Leo Hill had, thought it might be most, but not all of the money,
Yeah.
but we'll have to look at that dollar amount.
I imagine the state is keeping a certain amount for their. Well, the Go North itself has to have. What, 8 to 14 employees or something? There was some big number that
Mhm. Mhm.
they're planning to have work on this. So there's probably employees in public health, for example, that will be paid out of this too, I imagine. So, yeah. All right, well, I guess nobody's here in the room. We can go to the like that is online. And I see Mr. DeMayo has his hand raised. If we want to open that up.
You should be able to.
Thank you, Mr. DeMayo. I believe you can speak now. We can hear you. I can't see it. Glasses on it. That's
He's still-
He's still muted.
Oh, it looks like is that really a?
Yep.
So bear with us. We're not as skilled at this as Sam is when she's here.
Hi, can you hear me now?
We can.
Okay, thank you. Can you tell me, I gotta rephrase this, I can't ask a question. Is it my understanding that there are no requirements for the 3% COLA for the employee council and no requirements for the boomerang proposal that gentleman mentioned this morning? Is there shouldn't there be a requirement regarding, when they can take that? I'm getting to the point of calling it vested. Do these individuals have to be vested in the system? Like after 10 years, or is this something they can do immediately? Because it's from listening to the conversations over the years now, it seems like we train the LNAs. And are you saying that they can work for a year or two and then leave and then come back, and we're gonna bribe them to come back into the system with a 3% COLA or with other benefits? Don't they have to be vested? I mean, I had to be vested in my public school system for 10 years before I could get, and 35 years before I could get a COLA.
Anything else, Mr. DeMayo?
You're not gonna answer me, huh?
All
right,
I
I'll
can
get-
answer you on, we don't want to get into a conversation at this point, but we can certainly either
you'd hate-
address
I
it
know.
next week and during our meeting, or you could call one of us and we will see what we
Sure.
can do.
Yeah, I know, you have
respond.
to, you're like a football team, you have to huddle. Okay,
No,
I'll-
it just said, it sets up a potential for, issues of, I mean, we just don't want to get into that. And I would refer people back to the Sunday Union Leader on the second page where the City of Manchester Alderman's Board has a discussion on this very issue, which is really enlightening.
Which one? The boomerang or the?
The discussion around answering questions during.
Oh, that.
Yeah, public comment.
Oh.
Yeah, and I just found it very interesting and their reasons for.
well,
maintaining-
I think you should consider that. I don't know what the policy is, but I would think that would be vested. I mean, that would end up leading to double dipping. And,
Thank you, I understand, we understand your comment.
all right,
Thank you.
thank you very much.
Yeah, Emily, did you have a comment for us?
Let me just unmute her.
You'll be unmuted now. But yeah, it was an interesting discussion they had at the, yeah, it was on this.
Okay, have her
Okay.
to try.
You don't get into those.
Seems pretty
Thanks.
obvious. to me.
Yeah.
Mute her. But she should mute it, good.
All right, Ms. Smith, you could unmute yourself from your end if possible and make a comment. There you go. All right,
You can hear me.
we can.
Actually, mostly I wanted to make sure that my mic was working because I think I have now figured out what the problem was with being able to unmute. So thank you very much for acknowledging me this time, since I have a new laptop and I wasn't able to unmute on it previously. So thank you very much. And essentially, my question was the same thing about having an LNA that was being trained by the county. And then if they did return, I felt that it needed to be that they had stayed and fulfilled their obligation in receiving the training from the county prior to returning and then getting additional benefits. Having worked in school districts, and yes, you had to get vested for 10 years in order to get any benefits. Thank you.
Thank you. Okay. I see that Mr. DeMeo, you have your hand raised. Did he have some?
That was from before.
Oh, from before. Okay, you want to put your hand down then, Mr. DeMeo? Unless you had time left. All right, any other online? I see Janice Novak and Representative Spar. But no hands. Okay, I think we're all set to adjourn.
I will make a motion to adjourn.
Second, all in favor? Aye.
Aye.
My
All right.
gosh. Thank you.
Oh, my